Good morning, everyone. This is Chris Lindgren with Mass Bio. Thanks for joining us today. I want to thank the generosity of our speakers and also to thank our HR co-chairs, Lauren Solano, Chris Tamburini, Anna Welland, and Cheryl Vaughn. Please be sure to use the Q&A function for questions. Just click on that Q&A icon in the bottom center of your screen, and you can put questions in at any time. With that, I'm going to turn it over to today's moderator, Eileen McEnany, who is president of the Max Taxpayers Foundation. Over to you, Eileen.
Good morning, everyone. Thank you, Chris. Thank you all for joining us today. We have a terrific forum in store for you, and I'm so honored and pleased to be able to serve as the moderator. Each panelist, and we have 4 distinguished panelists with us today, will introduce themselves, and they'll each talk individually about their perspective, and then we'll have a panel discussion, and we'll leave plenty of time for your questions. So that's how our hour will unfold, and I imagine it will go by quickly. So without further ado, I would like just to introduce myself and how I came to participate in this discussion. So the Mass Taxpayers Foundation, as the name implies, is a nonprofit research organization focused on fiscal issues and the economic well-being of Massachusetts. But we formed an initiative, it's called Mass Cares, and CARES is an acronym for Communication and Awareness Around Recovery and Employer Support. And it has to do with getting employers involved and more aware about the signs and impacts of opioid misuse. And it really stemmed from research work we did about the economic impacts of the opioid epidemic in Massachusetts. And the research was astounding. It showed in 2017, Massachusetts spent about almost $16 billion on the opioid epidemic. And so in addition to the human and societal tolls of substance misuse, there are real and significant economic ones as well. And so we wanted to engage employers in this space. And while our initiative is much more targeted just on opioid misuse, I think a lot of what we're trying to do is directly applicable to the broader topic of mental wellness. It's really it's a component of the broader concept of mental wellness. And so I'm really pleased to be a part of this discussion. I hope if you're interested in learning more, there's a website, Mass Cares, happy to share that link with you. But really this is about engaging employers as part of the solution. And we have 4 panelists who have been very active in this space, and they can share with you unique perspectives. So first up, I have Casey Fleming. And she's the Director of Value and Access at Sanofi Genzyme. And as you all know, Sanofi Genzyme is a global company and a large company, and they have taken a very proactive approach and a broad and comprehensive approach to mental wellness. So Casey's going to share with us kind of what prompted the company to engage, what the components of that program is, and just other insights that she may have with respect to it. So Casey, thanks.
Thank you so much. Well, good morning, everybody. So as Eileen said, I'm Casey Fleming. My day job is Director of Value and Access. My moonlighting or my passion project is working as a preceptor for inclusion and diversity, really focused on total well-being, and that includes especially mental health awareness. And so in our total well-being division at Sanofi, we focus on 4 key components. We focus on health and wellness, financial aspects, work-life balance, and culture. And within that, umbrella, of course, mental health definitely falls into place. And I think as the organization, as long I've been here, I think 11 years, and as far back as I can remember, there were discussions around well-being. In the last several years as a culture, that discussion has gotten much louder, and so Sanofi Genzyme has taken steps, and really it's a credit to the inclusion and diversity group as well as the leadership within the organization that really believes in creating that kind of culture, that culture of wellness. As far as mental health goes, in October of 2019, we had World Mental Health Day in October, and that kicked off a new campaign for us. And we called that campaign, "It's Okay to Not Be Okay." And we had a wonderful speaker come in. She talked about grief, and she talked about loss, and she talked about various different areas of mental health. And that was a really passionate discussion that helped us even further destigmatize, I think, mental wellness in the workplace in that discussion. And with that, we have a whole suite of resources. And I think the really nice piece of that is that it's low touch to high touch. Not everybody wants to speak with a counselor live. Not everybody wants to text into a chat feature with somebody that's not personal enough. And so I think the really important thing is that we have this Ginger app, which is a wonderful app, and that's the technology where people can text in with a health coach or a licensed social worker and really go back and forth. And that resource is available for those 18 and up. We have our EAP counselors, and a really wonderful feature is that they can, each employee and their household, so under 18, get 5 free sessions with a counselor. And then after that, of course, we have, our usual healthcare benefits where, if you need more than 5 or want more than 5 for any member, they can be referred out. That's a separate procedure, but we have all of those benefits, including consumer medical for second opinions. Telehealth is something that has been really big and helpful. And we have a behavioral health component with our telehealth as well. We also have meditation and mindfulness sessions that we do in the workplace. That's kind of my passion. That's in my former Californian area of love, right? And then on-site counselors at 4 different locations. So that's really where we've been. I think COVID really changed the dynamic even further. And I know that we're going to get into that in the discussion today, and other people will talk about it. I think we've added the telemedicine options with no copays. We've done more daily classes. So in addition to, having mindfulness or meditation a couple times a week, we had every single day mindfulness. We have stretch breaks every day. We have yoga and Pilates weekly. We really try to build in other resources to help our employees out, and done some things different, right? We've done virtual classes. I know that I did in my kitchen cooking class. We've had ergonomic classes. We've had sleep classes. We've had all sorts of different topics. And this month, tomorrow actually, we have our Mental Health Awareness Month speaker event. And we're bringing in Mike Vini. He's a very well-known mental health awareness speaker and advocate. He's going to speak to our team, and Bill Sybil, the head of our company, will also be speaking. All of our leaders have done a beautiful montage sharing their personal stories. So really looking forward to that. And we've rebranded it. We're not okay, and it's okay, because as we know with COVID, nobody's left without impact, right? So that's really changed how we talk about mental well-being. And then finally, we're introducing a new vendor partnership that's really going to offer education resources for both managers and individual contributors to help them on demand have education around mental well-being and different topics. It's an expert panel. So that's really our take.
Thank you, Casey. And I think, I would just underscore one of the points you made about the importance of leadership. So I think for a company to really have success, I think the direction has to come from the top. So kudos, to your company for that leadership. I think it's critically important. Andy Porter is our next presenter, and Andy offers a different perspective. He can share with us, what a small company looks at and kind of their thought process with respect to it. In addition, he can talk about academia and the different challenges that they face. And so Andy is the Chief People Officer at Relay Therapeutics. So Andy, please share with us kind of your approach to mental wellness as a company.
Sure. Thank you, and really happy to be here, and thanks for all the participants who've joined. This is a really important topic, and hopefully we'll take at least one thing away from all of us. So I'll talk about this from 2 perspectives. As Eileen said, I'm currently the Chief People Officer at Relay Therapeutics, for a small biotech company, in the 120 or so people. I've been there just about 6 months, so I'm a relative newcomer. This is quite a time to start a new job. I've noticed. Prior to that, I spent about 5 years as the chief people officer at the Broad Institute, in Cambridge. So I want to talk just a bit about both of those experiences. There's some similarities, but there's also some differences. So I'll start with the Broad, since that's where I spent big chunk of my time in the last several years. Excuse me. So from my perspective, one of the most important things, and I'm sure my panelists will share this opinion, is how do you make it okay to talk about these things in the first place? That's probably the number one thing that all of us are challenged with. And for us, there at the Broad, there were I think a couple things that were going through our heads as we started to think about how to make it okay. Number one for us was how to link it to the work that we're already doing. So these things there's many topics that are important in general, but I think for an organization, to the extent that you can make it connected to your business or connected to the work you're doing, that's important. So for us, that came in kind of two flavors. One was we had through the Stanley Center for Psychiatric Research, we had a really significant effort going on at the Broad around psychiatric research. And I think the importance of that work obviously will be with the resulting drugs that may come out of this research. But I think more importantly, it was turning what had previously maybe been thought of as not an illness, but just something you don't talk about, into like that there are scientific underpinnings that we can look at as scientists and understand that these are diseases. This is not something that people are making up or are just saying, for whatever reason. So I think that grounding and that tying back to something that was important to the organization mattered a great deal. The second thing related to that was the Broad there's a lot of things going on there, but I think one of the core tenets or core principles of what the Broad does is developing the next generation of scientists and next generation of academics, next generation of scientific leaders. So that gave us, I think, a unique perspective to think about. We aren't just trying to support our population today. We are trying to help folks who are in the future will be leading labs, who will be leading other groups of people. And it's a challenging point in one's life when you're a graduate student or a postdoc or getting your PhD. I mean, these are not easy times. We had a population that we felt was important to connect to and support in conjunction with our partners in the universities and hospitals. So that was probably the biggest thing, was just having the overarching perspective. The second thing was just making a concerted or a visible investment in this is something we care about. So one of the first things that I did when I got there to the Broad was we created what we called the Broad Life Office. And that was different from having the benefits office, which the benefits office does important work, but was mainly focused on benefits. The Broad Life Office, which was not coincidentally run by the same people that or was running the benefits organization, but had a very different focus, which was how to support the health and wellness of all of our employees and people in our community. And that gave us the opportunity to say, we are thinking of this more broadly than just how much is your copay. It's to think about ways in which we can support people more broadly. And what language do you use? Is it mental health? Is it mental wellness? Is it mental illness? And we had lots of debates around what is the right language to use. And and we didn't always get it right. I mean, calling a mental illness, mental health also didn't feel quite right. I mean, you wouldn't call someone with a serious disease, they just have a cold. So we had to think carefully about the language that we used. Then I'd say the last thing there was developing programs were really important. And one of the things I really enjoyed about my time at the Broad was the ability to pilot and test and experiment new things. So one of those things was we experimented with, we called it nearby access to counseling. And our analysis was, people who need mental health support, it's hard to get that access. It's hard to, like, I'm working, I'm in, when you used to go to an office and sit at your desk or your bench, it's hard to get away. So we had a partnership with a local organization where our employees could either very close by, like within walking distance of the Broad, go seek mental health support. And then we're layering in some of the stuff that Casey said around access remotely, et cetera. And then I think the most important thing that I learned from the time at the Broad is you can have all the programs, all the language set, all the things in the world, but the thing that mattered really most was the community. And we spent a lot of time trying to help others, people in our community, be aware of others and be aware of, is your colleague showing up differently today? You interact with your colleagues more than the central group would ever. And if you notice someone's not doing well, what do you do? How do you support them? How do you ask the right questions? How does it not feel like you're selling someone out if you say, hey, I'm worried about so-and-so today? We spent a lot of time trying to think through those conversations and helping people to have them. Because from my point of view, that was the most important thing, is I, in my role, certainly was not going to see the vast majority of what was going on, but the postdoc who's sitting next to the graduate student and sees that person every day is going to be on the first lines to see what's actually changing in their lives. And frankly, this is way more challenging now when you just see everybody on video. Like, how are people actually doing? So that's the big academic center perspective. Relay, which is very different. So it's a biotech company. So I've been there again just a few months at this point. And there's a few things that I will say just so far that we're doing. So number one, and COVID really sparked this, is just you get a real glimpse into what people are struggling with, which, I mean, you're literally seeing it. I mean, my kids haven't come by yet, but you will likely see them soon, popping into the video screen. So we use this as an opportunity to, as often as we can, reaching out to people, just understanding your story. Now, you can do this at 100 or some odd people scale, which you can't at the Broad, which is several thousand people. But this gave us the ability to, on a consistent weekly basis, reaching out to people. How are you doing? What's going on? And we've had many in our leadership community doing that. The second thing that we've experimented with is, how do we create role models for within our community to help people see that it's okay. So, I mean, Casey had an example of it's okay, or not to be, or I didn't get it exactly right, but we used a version of that, which is it's okay to. And, we started a hashtag around that earlier, this month, where I made the first post and said, it's okay to, and I gave a list of, what's going on, and I took some pictures, and that's been one of the most popular threads that everyone has contributed, to in the company. And we did something else, which was, I think, it was funny, but it was also really important, which we called it Instagram versus reality. And it was a series around, here's, so people had a picture of here's a beautiful cappuccino with the flour on top or whatever, and then here's what I actually made. And we had a series of people in a video montage, and we shared that. And it was funny, and people laughed about it, but the important message was, we all have facades to some extent, but the reality of what's happening behind us is really what's important. We are all people, and let's not forget that. And then the last thing I'll say, and then I will stop, is something around support groups. And support groups come in all shapes or forms. So we've had very specific ones so far where it literally is called, it's a support group, and people have signed up. But there's lots of ways to do that. It could be as simple as getting 3 people in your company together over lunch, and that becomes a support group. So we've realized that there are lots of ways that we can support each other as a community. It just sometimes is a prompt to get someone to take the lead to organize that, but it doesn't always have to be this really specific and big program that a company has to launch. So I'll stop there. There's more we can talk about, but I'm sure we'll get to that later.
Thank you, Andy. Appreciate that. And so I think that you touched upon a couple of things. I think there's the threshold question for a company. Do they want to engage, and to what extent, on like mental wellness? And then, assuming that they do, how do they, and what are the components of a program? And so our next speaker, Chris Dovell, who is the clinical director at ARC Behavioral Health, has expertise in recovery, but in what it takes, or what the component parts of such a program should be. And so, Chris, looking forward to hearing your comments.
Thanks, Eileen, and thanks, Andy and Casey. You guys definitely hit on a lot of points that I'm hoping to kind of build upon in the next few minutes. So again, my name is Chris Dovell. I'm the clinical director at ARC Behavioral Health. We're a full-service behavioral health company offering both direct service as well as support education for employers and providers, as well as a company that offers full-service navigation through the behavioral health world. So I've seen this, this integration of wellness and worked on the governor's task force down in Rhode Island on developing the recovery workplace initiative. So I've seen this integration from direct service, behavioral health provider, and then integrating it into policies across the employer and workplace sphere for a while now. And there are a few key elements, and some of which have been made really important. So in addition to all of the work that I've done in this, one of the things that I think is most important for me to recognize and acknowledge is that I am a person in personal recovery myself. And part of the reason I say that is because I think one of the key elements to creating and establishing a recovery-friendly workplace is to make recovery visible. We want to create a culture where, you know, it's okay to be, to not be okay. But we also want to see that coming from you know, direct personal contact and see it from kind of a personal view. So developing, you know, making it a visible part of your workplace culture, something that is acknowledged, something that is talked about, not something that is taboo or hidden. You know, that's one of the major elements to developing and establishing this recovery-friendly workplace. In addition to that, having a clear written policy supporting both recovery, wellness, and avenues for folks to get help. Both Andy and Casey talked about things within their organizations that are available, things and initiatives that they've been launching to kind of create and sustain wellness throughout the company, which I think is incredible and is great. And I think we should see more of it as across the board from employers. Another major component or key element of establishing a recovery-friendly workplace is to develop employee education and stigma reduction training. One of the biggest barriers to receiving help across the healthcare spectrum, and really anywhere, is the stigma that's associated with not just needing help, but having to ask for help. I was on a phone call yesterday with somebody who's in the farm world, right? Pharma sales, and he's like, you don't understand, it's a really small industry, you know, the healthcare industry in New England. And if I see anybody in there and they know that I'm in there getting help, and I'm thinking as he's telling me about his stories of like going out and drinking and taking too many pills and falling asleep at dinner meetings. And I'm thinking, nobody thought it was a problem then. You weren't concerned about what people thought then, but God forbid you ask for help. And I thought, it's just this stigma that's so highly associated with seeking help. So developing training for both employees and employers on how to reduce that stigma, how to make it more visible, how to make it something that can actually provide people with the access and avenues to get help. Andy, you had mentioned the idea of kind of peer-led or peer support programs. That's another major key element in developing either employee assistance or peer support or both programs that offer this. The more successful employee recovery wellness integration platforms that I've seen have all developed or have all had some type of employee or peer support assistance, where people can connect with other people in their community and kind of serve as a liaison or kind of a branch to both work and life balance and recovery. Another major key element, thinking more on the policy side, is making sure that you have access to treatment and that there's connections with providers, that companies establish these direct relationships with providers and with organizations that can help provide their employees with direct access. Being in the direct service field, one of the things that we know, particularly in behavioral health, is that it's very often that window of willingness closes very quickly from when a person is willing to get help to when they'll actually get help. And if they have to make more than 2 or 3 phone calls to actually receive help, it's very likely that people just get frustrated and give up. So making sure that we have a really clear, direct path and access to help is really important. And then finally, having informed health plan options as employers that allow for access to behavioral health services. And allow for a variety of these services to be included as we're looking through it. And this is very important for those of you who are in the human resources world of like, what do our plans offer? What are the options within our plans? Can our employees actually get the access? Because once you've overcome all these other barriers to, whether it's stigma, access, and finding a provider, and finally to get there only to find out that your coverage does not provide the services that you may need, is just the last, the last straw to break the camel's back. So establishing these key elements, the policy, the education, the peer and employee support programs, the access to treatment and relationships with providers, and finally, informed healthcare options are really the key elements to developing that culture of recovery-friendly workplace within the employee world. So I guess that's pretty much what I have to add for now.
Hi, can you hear me? So, thanks. Sorry. Appreciate that. And certainly, Chris, you and I have had the conversation, but that is a lot about what this Mass Cares initiative I referenced is about. It's about helping companies understand, what are the resources or what are the steps they take. And it can start very simply reviewing your benefit package. Is it designed the way you need it to be, in the way you want it to be, or the way you assumed that it is? And so thanks for sharing those components. And our final presenter is Dr. Dante Burgos, and he gets a special shout out because he's joining us from Texas. And so he got up bright and early to be with us today. So we do appreciate that. And Dr. Burgos is the Chief Physician Executive at Mind Care Solutions. And they have been thinking about the use of technology and integrating that to kind of augment and enhance some of these benefits. And so would love to hear your perspective, both as a clinician and as an executive of this innovative company. So Dr. Burgos.
All right, thank you very much. I'm thrilled to be here. Everyone can hear me all right, I hope. Again, just very quick, a little bit about myself. I'm a board certified psychiatrist specializing in child and adolescent and adult psychiatry, and of course with a lot of experience in addiction as well. I want to thank the previous panelists. They stole most of my thunder this morning, but it is wonderful that we have so much attention that's being paid to mental wellness and health, especially this time and this extremely unique time that we're going through with COVID. Very quickly, a little bit about Mind Care. Mind Care and the company that I was associated with prior to Mind Care, we began to identify many of the same issues that have been already discussed this morning as a resident in psychiatry 30 years ago. Dating myself a little bit here, but it was even clear then that psychiatric care and psychiatric services were in woefully short supply. And actually, studies that were done at that time even indicated that that gap would grow as we headed into the 21st century. And it has really, even since 9/11, has continued to widen. So Mind Care was created with the idea of really trying to meet the need initially at the crisis point for folks who were already in pretty deep trouble. So a lot of the early focus was on providing hospital-based services for crisis stabilization. But we are now very fortunate that we're in a unique opportunity to really kind of work our way backward towards the front end, where we're more focused on prevention and identification. And as Andy pointed out, and some of the others, the big stigma about psychiatry has been, in many cases, the reason that folks get to a crisis point before they actually access a psychiatrist or even a hospital system. And in hindsight, if we could have identified some of those issues very early on, it would have been so nice to be able to make that intervention and those preventative steps that were needed. The association, by the way, with Ginger is very exciting for us because the accessibility of being able to have that app, that platform, which allows clients to very safely reach out to someone, and it even begins at a life coach level, and to then have an excellent team in place to determine, okay, is this performance-based anxiety that we're talking about, or I'm worried about what my kid is doing in school, or COVID-related concerns about a family member, and how those things can grow into a better understanding as you attach with that individual, that coach, and you get to know each other, it becomes a lot easier to implement screening tools to determine if there's a deeper anxiety disorder or depressive disorder, and then be able to kind of make that next level referral to a counselor or a therapist, and then even if need be to a psychiatric intervention. To an earlier point, part of the ability to overcome the stigma has been exactly about explaining that major depressive disorder is a medical condition, just like asthma or diabetes or hypertension. This is brain chemistry we're talking about. If you're a diabetic, you're not producing enough insulin, and if you have severe depression, whether it's serotonin or dopamine, you can begin to help them wrap their mind around the idea that this is a medical condition and that this is not through a fault of my own or a character defect or whatever the case may be. And so with Ginger and programs like that, where we're able to get that early intervention, the wellness component and focus, and then be able to screen for any additional interventions, has been a very unique, proactive way of helping folks in the workplace. And I know we're going to do some questions a little bit later on, which I'm looking forward to talking about, especially related to COVID and what we're dealing right now. And I look forward to being a part of that panel discussion. Thank you.
Well, thank you. And so why don't we jump right in? I mean, I think that we all realize that our world is upended, right? You know, we're actually having this conversation via Zoom and not in person. And, you know, we're working out of our basements or, you know, other places. And certainly our daily routines have changed. Our interactions with each other has changed. And there are additional stresses that the pandemic has brought on. And so let's talk about what some of those unique challenges are and how you're addressing them. And I guess I'll just go in reverse order. So Dr. Burgos, you had started. Why don't you just kind of finish some of that and then we can go through the list.
Sure. Yeah, so I think with regards to the pandemic, you know, once in a lifetime occurrence, and that's plenty for me. I think it's really important to see what sometimes will fall by the wayside in very unique times like this. One of the main issues is the concern that the things that we used to do to take care of ourselves in day-to-day life, we lose focus on getting away from those very things. So the emotional component of the COVID seems to be overlooked because we're all so worried about putting on that mask and the social distancing that we forget that, oh, by the way, I had an anxiety problem or a depression problem that seems to have been neglected. And so that's one of the consequences that we have to stay vigilant to. And I know that Andy and others will speak to this. Unfortunately, maladaptive patterns can fall back into place, and the risk of relapsing behaviors is especially heightened at this time. I happen to do some side work in one of my day jobs at a methadone clinic, and it is very real, the challenge of how maladaptive patterns have caused a significant escalation of symptomatology, which we really have to stay on top of. So those would be the main things to keep in mind with something so unique as COVID, so that we stay healthy and stay committed to the routines that really keep those forces at bay.
Terrific. Chris, your thoughts about what's unique, or what are the unique challenges from the pandemic?
Sure. So I think some of the unique challenges aren't so unique, but just amplified to a degree that we've not experienced before. So things like fear, stress, and disconnection, which are all major contributing factors to any mental health or illness condition, are, you know, magnified times 10 at this point, if not greater. So we're seeing people being more disconnected than ever before. Whether it's the fear of health, fear of safety, fear of economic insecurity or financial insecurity that everybody is facing right now, is really driving up, as Dr. Burgos had mentioned, these unhealthy or maladaptive behaviors. There's also been a level of social acceptability to these unhealthy or maladaptive behaviors that we're seeing, where, You know, it's okay to start drinking at 3 o'clock in the afternoon because you're at home and you're not driving home from work. Or it's okay to take an extra Xanax this weekend because, you know, you're not going to see your family anyway. Or maybe you have to jump on a Zoom call and you're not sure on how to do that. So we're seeing a lot more of that. It's interesting. I had a patient of mine say to me the other day, you know, I always wanted the entire world to feel the level of anxiety that I felt on the inside. And they finally are, and they're not handling it very well. And it was kind of a funny comment, but funny in a way that, her experience of experiencing social anxiety and this fear and this worriness and these intrusive thoughts that she's been dealing with her whole life really put into perspective for her how the world is handling it. And she's like, you know, if I started wearing a mask and walking around washing my hands every 20 seconds before, I would have been diagnosed with, with an anxiety disorder, an obsessive compulsive disorder, a whole host of personality disorders that possibly, and she goes, now it's totally acceptable. She's like, it's totally acceptable. Not only is it totally acceptable, it's an executive order. You have to do these things. And she's like, these behaviors that before were pathological are now so acceptable. These feelings of disconnection, these feelings of pushing people away and becoming more isolative, which were unhealthy patterns for me, and I was counseled that I need to move away from, are now being told that I ought to practice these things. And it's made it, I think, a challenge for direct practitioners like myself, and I'm sure Dr. Burgos would agree, in trying to adapt how we use psychotherapy and tell people and counsel people in certain directions. Because it used to be, well, get together with friends and close loved ones and connect and get out there, get exercise, do something fun for yourself, practice self-care. And now it's like, just watch another show on Netflix. You know what I mean? Like, have you seen this yet? You know what I mean? Like, and we're running out of ideas, and as great as this platform is of Zoom or teleconferencing or whatever you want to call it, it is never going to compare with the direct interaction that happens from human connection. And the direct human connection now, especially in the world of wearing a mask, and we've all experienced this, whether it's at the grocery store or a pharmacy or anywhere out in public, where you've actually seen someone wearing a mask and realized you're actually afraid of them. That we're no longer viewing people as people, we're viewing them as viral threats. And so our sense of fear is so drastically increased in the world that we live in today, that we're all walking around, to get kind of scientific, we're all walking around in our limbic, in our amygdala right now. We're all on that fight or flight response. We're all stressed out. Even at our best, we're stressed. And so it's definitely created this unique challenge for how to provide services, how to find peace and comfort and any type of ability to cope in this current world situation we find ourselves in.
Yeah, and I think, one of the first steps is just being aware of that, right? That we are in this unique circumstance so that we can react. Andy, let's hear from you. Your thoughts
Sure.
with respect to the pandemic.
Sure. Two things I would share. First is, this will sound silly, but there's just nothing else to talk about. And it's become more obvious to me that you don't realize like how often in the workplace you're like, what did you do this weekend? Or tell me about it. That it creates a sense of community and conversation that, now everyone's, well, if it's the same day, I don't know if it's Saturday or Monday or Tuesday, whatever day it is. So I think that's actually been a real challenge. And for us as a smaller organization, I think we've had, the benefit actually to be able to create little groups or discussions about something that's not COVID related, or, little events that people can connect, and just like, so it's not focused only on the negative and focus on the work. Like people who are doing interesting science, reminding people of that is really important. But that's been hard. It's just you don't have the breadth and depth of things that you would normally do in your day-to-day lives to engage on. So what I worry about is it creates this doom cycle of you're only talking about negative things, and all the stuff that Chris is saying is right. You're out there walking past people and you're like walking away from them. It's just a very weird situation to be in. But I've been trying really hard in this last couple of weeks, particularly to look for the positives in this. And that's maybe a weird thing to say, given all the devastation that's going on out there. But I do think there are some positives embedded in what's happening now. And for me, the biggest single one has been, we are talking about wellness and emotions in ways that I've never seen in the workplace. I'm having conversations with my CEO all the time about how are people doing? How is their emotional well-being? Like, what can we do to support them? These are conversations that, maybe would happen from time to time in normal times, but now it's become it's an essential part of running a business. And so it'll be interesting to see how much of this we can keep on the other, whatever the other side looks like on new normal, and not have it just go away. Because I do think there are some glimmers of important stuff that's happening now that could be foundational for.
I think you're right. And you hit the nail on the head about just our focus kind of on the negative, but also, the need to focus on the positive. And Casey, you've been very patient. So let's hear from you and your thoughts with respect to the unique challenges from the pandemic.
I don't know about a bit patient. I've been hearing great stuff. I think, to echo some of the sentiments I heard, right? I think there's one positive. I know we're talking challenges, which is that we really are all in this together. I think, I never in my lifetime thought I'd see something like this. And I think that brings everybody to the same level in a way where, the executive vice president, and it doesn't matter what level you are, we're all experiencing pandemic and we're all home. I think the unique challenges in a company as large as Sanofi Genzyme are that we do have employees that have been going to work the entire time, because if they don't go to work, we don't have medicine, right? And we don't have drug supply. We have nothing to service the patients that desperately need our therapies, right? And so we have critical workers that have been going in. At the same time, we have the majority of our workforce that's been working from home, and have kids. I think, Andy, you said it, we have kids running in the rooms, dogs barking, UPS people coming, thank God for them. I'm not saying it's a negative, but everybody's, even though we're all in this together, we're all in this in a very different place, right? We're all individuals, we have individual needs. And so to try and meet the needs of that vast population of people, and make sure we're catching everybody where they are, has been a challenge. And so to do that, I think, on the plus side, we've seen involvement in activity like we've never seen before. I mean, we're having 100 to 200 people in a yoga class online. We're having 3,000 people doing steps challenges when usually our participation wasn't that high. I get personal questions about Ginger and some of these other resources, as do my colleagues, which touch me and make me feel like, we're meeting people where they are, but because there are so many different perspectives and there's so many different challenges, it's very tricky to get everybody everything they need. And I think that's the biggest challenge, right?
Yeah, and so while you have the floor, I do want you to just respond. I mean, you talked about the sense that we're all in it together, and I think you're right. And in some ways, I think that's a big step forward in reducing stigma. But let's talk about stigma, and I am mindful of the time, so I'm going to ask each of you to do this somewhat in a kind of rapid fire way, but just what works to reduce stigma, what doesn't, and let's just talk about that. So if you could share kind of both what's worked and what hasn't for you.
So awareness and education are what works, right? I think we've realized, and I've heard other people say the same thing. If you're not aware of how people are feeling, or that somebody might be down, there's nothing you can really do about that. So we've increased awareness and we've really bolstered education. What doesn't work is not meeting people where they are and not being aware, and that just doesn't work for us anymore, right? We have to change how we are. I think somebody else said it. Every time we get on a call now, how are you doing? How's everybody? Is everybody okay? Right? Instead of asking the question, what did you do this weekend? Or, like we normally would. So I want to be succinct because I know you need us to be rapid fire. So I'm going to stop there. I'm sure people have other great things to say.
Thank you. And Andy, how about you with respect to stigma? What's worked, what hasn't?
Yeah, I mean, I think I probably, hit on some of these things already in some of my earlier comments. But maybe one thing I would add is I wouldn't underestimate that it's still an individual choice. And I think we can do all the things in the world to make it okay, but that's from the perspective sometimes of a company. It's okay if, from a company perspective for you to say, but each individual is making a calculation of what they want to share and what they don't want to share. So I think we still need to respect that and make it okay, but not force people to talk about things they still may be uncomfortable talking about. And I think that would be true for any kind of illness in addition to mental illness.
Yeah, I think respect is a critical component. Thanks for adding that. Chris, what about from your perspective?
Education and awareness. The more we can educate our employees, our staff, our management, and everybody in between. I think a lot of times, particularly in the behavioral health world, we focus on behavioral health conditions as being locked in, and we don't recognize that we all experience some type of depression, anxiety, fear, stress. We all have these things. And so to really create that education and awareness, and to also create education and awareness around what treatment looks like, or what support looks like, what help looks like. Whenever I'm talking to somebody about getting some type of psychiatric or behavioral health treatment, they're like, no. I saw a movie one time where all these people sat in a group room and cried, and I'm not doing that. And I'm like, you don't have to, right? Or, we talk about things like TMS or ECT, and they're like, I'm not doing shock therapy. Didn't they do that in like an asylum in the 1930s? And I'm like, no. And so really educating people on what treatment is, what mental health or wellness is, and what it looks like, and really normalizing the conversation. I think that if we don't talk about it, and again, I agree with Andy, we can't out everybody's mental health, and that has to be an individual decision. But I think normalizing the conversation, talking about it, being as open as we are comfortable with our own experiences, our own struggles, and really seeing that from a leadership perspective is really important in reducing stigma within the workplace.
Thanks. And Dr. Burgos, anything to add?
Sure. Well, and obviously coming from the medical perspective, I can't help but go back to something that Chris said earlier, that we are living in an age where what were once thought to be irrational fears are now rational fears. And so in psychiatry, we talk a lot about, the fact that as human beings, we have anxiety. We have periods of sadness. We have periods when we get angry about certain situations that are not going our way. But we talk about that being the normal neighborhood, if I can use the word normal here. But when does anxiety become a disorder? And when does it become disabling? When does sadness about what we're living in right now or going through, when does it become maladaptive in terms of how you're coping with things? And then we're able to, once that comfort level has been established there, and in the relationship that they're having with that particular advisor or counselor, then we can begin to dig down a little bit deeper on getting to know, well, where does this anxiety come from? Is there some family history? And then you can get into genetics and neurochemistry, and those for those who need it. And so it all begins with the fact that we are all dealing with the same set of emotional stress points in this time, and let's figure out a way to get through this together.
Great. And before we open it up to the audience for questions, I want to end on a more practical note and just ask each of you what success looks like for your mental wellness program. How will you measure success? And for this, I'm going to start, Casey, with you, because Santa Fe has obviously invested a lot of time and resources. And so what are you hoping to get from that, and how will you measure success?
Yeah, I think that's a really good practical question, right? We are running business at the same time. I think, one is engagement. Like the level of engagement that we have is a huge KPI that we're using to assess whether or not these programs are helping, whether they're working. And the fact that we're seeing attendance continue to go up means that there is a reason, right? There's a really good reason to do this. I think when we look at mental well-being overall, this is something that's attractive for talent. You want to work. People want to work in a place that cares about them, right? That it's more than just a job. It's the world's changed, right? Self-care. If I hear self-care one more time, it's almost become a buzzword for manicures and pedicures, but it means a lot more than that, right? And so, one of our big metrics is retention. Obviously knowing that people want to work for the company and want to stay. We look at productivity as well. I think every leader we have in the video mentions that if they're not well rested and they're not taking care of their own mental well-being, they're not going to be the best for their employees. They're not going to give people what they need. And so really workplace productivity is another thing that we look at, and keeping our health costs down, right? I mean, if you take care of people, then that's what happens. So I think there's a lot of very practical KPIs. At the end of the day, inclusion and diversity cares deeply about everybody, and it's more than metrics, right? But the metrics are how we measure. That's really the only way we can know.
Thank you. And Andy, how about for your company?
Sure. Yeah, I think it's different from a size scale, but there are one similarity I would say is engagement. Are people participating in, engaging deeply in the things that we're putting on? So that's something that we're obviously paying attention to. The second thing, at least how I think about it, is maybe a little more squishy than maybe we would like, but it's really an answer to the question, like, do people feel like we're doing right by them, especially in this hard time, right? There's a lot going on. There is another side to this. So if the end of this, everyone's like, man, like they treated me terribly during this, I'm out of here. Like, we'll know. My hope is that folks will look back and say, the company did everything in its power to make sure we were being supported in a world where there is no playbook for this. And that's what I want more than anything, is people look back and say they did all that they could for us.
Great. And from the providers on the panel, how would you measure success? Chris first, I guess, and then Dr. Burgos.
Sure. So interestingly enough, with a viral pandemic, our business has been more successful financially. Our census has increased by 10% in the last month and a half, which is only a testament to how stressful and how challenging this world is right now for everybody out there. But I think from another avenue that we work in is, again, where we would see success, particularly as it relates to this topic, this panel today, is building relationships with employers, building relationships with agencies, corporations, companies that are seeking our assistance and our guidance, where we can be a true partner in working together to promote wellness across the workspace. That's where we really see and measure success moving forward after something like this. The patients will always be there, but how are we working directly to engage them and streamline the process? I had a patient that came to me the other day that said, honestly, this was the easiest thing I could have ever done. This was so flawless from start to finish, the first phone call to getting into treatment. He said, this was amazing. That is a measurement of success for me, because I've heard so many horror stories of people seeking and trying to navigate the behavioral health system that they've gotten frustrated and given up. So, creating streamlined processes with employers and is really a measurement of success for us.
Great. And Dr. Burgos?
Yeah, again, at the clinical level, there are numerous measures and scales that tell us in terms of how effective we're being, in helping to reduce one's symptoms and helping clients return to functionality. Again, I think that the main goal is, if a referral has come to us, and again, I'll mention Ginger here again, is if you've got that scalability from the beginning and all the way to the point where we're at MindCare now talking with a medical professional, we have numerous ways of quantifying symptom reduction, return to functionality, and obviously return to work, which is a key for the employers that we're working for. And it's really a matter of initiating those strategies to help that client get back to their previous level of functioning.
Terrific. So I want to now open it up to the audience questions, and I'm going to, in the interest of time, direct this one, Casey, to you for a couple of reasons. One, you had talked about the need for leadership at the top, but what about a company where you don't have that leadership, or worse, you have bad management, right? And what are the initial steps that you would recommend to change the culture?
Yeah, I mean, look, no organization is perfect, right? I think we all start from somewhere, and 10 years ago, this wasn't a conversation that was had in the workplace, right? It wasn't a conversation was had anywhere. If you live with anxiety, I can raise my hand. You didn't talk about it, right? In the workplace, I think, it starts with education and awareness. Those are two things, that we feel at Sanofi. That's what I heard Chris say as well. I think, we start doing programs where we bring speakers that show the different faces of mental health disorder, right? So it's not all a DSM-4 criteria, or whatever, some diagnosis. It's all phases of it. We start talking about, basic day-to-day anxiety and stress. And so programming helps. I think education really helps. We're constantly looking at programs and platforms that provide education in a not threatening way. And just engaging around the topic. I think having the campaign, and I think Andy referred to something similar, we did the It's Okay to Not Be Okay, and now we're doing We Are Not Okay and It's Okay, right? Let's talk about what we're feeling as an organization. And I think just opening that conversation up and having leaders come forward is helpful. I think you have to have it both ways, though. If employees or individual contributors don't feel safe coming to their managers, coming to their leaders, there's two sides to it, right? So it is, yes, a question of getting leadership aligned, but it's also opening the door and helping the individual contributor know how to have the conversation or feel comfortable having the conversation. And I think the education is really how we did that. It was just those discussions and that education that really helped open things up.
Thank you. And so there is a question about burnout. How do you address it? The feeling that you're on all the time because, there's no separation between work now and home, and people have different schedules, work different hours and so forth. For people who feel like they're always on and it's getting to them, how do you address that burnout? And I guess I'll direct that to Chris and Dr. Burgos, and then I'll ask everyone to have final comments, about 30 seconds, final comments. But first, let's address the burnout question.
So burnout is nothing new to me in the behavioral health world, and I'm sure Dr. Burgos would agree. As mental health professionals, we're consistently fronted with this with our staff. One of the things that I think other employers might benefit from, that I think is a tool that we utilize really well, is direct supervision. Where we're checking in with our employees on a day-to-day basis. How are you doing? How are you doing mentally? Not that as managers or administrators that we're providing psychotherapy, but that we're actually actively asking these questions, checking in, seeing if there's a way that we can adjust workflow. As a clinical director and administrator, I'm constantly sending out emails. And I'm also recognizing that I might be sending these emails out at 2, 3, 4 a.m. because that's when I'm up, and that's when I have 2 small kids at home. I don't sleep. So I sometimes will have to make sure that I'm really aware of what I'm doing, but also including language and messaging in there that they do not have to respond to this immediately. Oftentimes, many of my subject line emails are, don't look at this until Monday, if I send it out on a Friday evening or a Sunday, because I know that the work from home balance, and I've been doing it for years, can be really stressful because your computer's always there, your phone's always there, and you might be going on to look at, if you received an email from your aunt or your family member and you just happen to see the 15 work emails that go before it, before you know it, you're caught down the rabbit hole of trying to come up with a complex analysis of, sales marketing, and all you want to see a picture of your niece. And so really making sure that we're targeting messaging, that we're utilizing supervision, and that we're really communicating to our employees, we're scheduling time for them not to work. That's been one of the things that me and our other leaders have really worked on is, you do not work on this day. If I send you an email and you reply to it, I'm upset. Like, I don't want you. So make sure that we're really targeting and clearly messaging that to our employees.
That's important. Dr. Burgos.
Yeah, I would agree with that. A lot of that discussion really focuses on the idea of structure and boundaries. And certainly in this field, mental health providers, psychiatrists, we're always putting 100% in, and knowing yourself, being able to say, you know what, in this time, I'm going to work 120% because I know that that's my upper limit and I will not go beyond that. And so if we don't model for those that we are treating and taking care of our own ability to take care of ourselves, we're really doing much more harm than we know. And if I my day job at a medical center where I'm the medical director, if I come in and I'm extremely fatigued and sleep deprived, not the most pleasant personality at that time, I'm not modeling healthy behavior for how to take care of myself. And so when I ask my workers, the nurses, the other therapists, the techs, how they're doing, they know that it comes from a place of genuineness because I'm truly concerned about their well-being and making sure that they're setting limits and being able to take care of themselves. And
Thank you.
It's a
So
theme.
we have probably less than 2 minutes. So I'm going to ask each of you for your 15-second parting words or advice. And Andy, I'm going to start with you.
Okay. I think I'll just reiterate what I said in my last comment is, although everything in the world that there seems to be negative, there are some positives here that can be taken out. And I would encourage everyone to be on the lookout for the lessons, the opportunities to build upon in the future.
Thank you. Casey.
Yeah, I just say I think building a well culture starts with Dr. Burgos's word modeling, right? And so if you want that, everybody within the organization, those that can, need to start modeling the well behaviors that they want to see and really try to meet people where they are, right?
Thank you. Chris.
And to build off of what Casey just said, I think I'd have to say, as employees and employers, learn to ask for help as an organization, and learn to know what you don't know. It's okay to ask for help. It's okay to seek guidance and support in these things because nobody is an expert at everything, and so utilizing the resources that are out there.
Thank you. Dr. Burgos.
Yeah, so I'm a glass half full kind of person, and I can't help but believe that we as a country, we're going to come out of this stronger. And I think that the beauty of a horrible crisis like this is that we start to really realize what are the important things, and it is taking care of ourselves, our relationships, and our loved ones, and hopefully opening up those circles. And I know we're going to get there.
Thank you. And Chris Lindgren, I would turn it over to you, to all who have stayed on the phone. Thank you very much for your participation. To the presenters, we really appreciate you sharing your expertise. And Chris, any final words from you?
No, I just want to say thank you for a terrific discussion. I think I got a lot of value out of it, and I hope our audience did as well. Thanks very much, everyone.
Thank you.
Thank
Well.
you.
Bye-bye.
Bye-bye.